and I think YouTube as well. So generally when we do these, I talk a little bit, we've been trying to make this more like the coffees that we would have out and about. And so if you want to put on your cameras, we'd love to see your smiling faces. I think all of you are being shy, so we can kind of have that real community connection. And normally we'll talk a little bit about what's happening with the current crisis, any questions, and kind of go into anything people want to know about the campaign as it still continues. But today we're really happy to have a special guest to join to answer some more questions, what's going on with the crisis, particularly here at the state level. And so I'm happy to have House Representative from LD18, Representative Jennifer Jermaine, joining us today.
Greetings, everybody, from the beautiful city of Chandler, Arizona.
Yes. So thank you for joining us today to kind of talk about what's going on. I'm going to make sure that everybody can hear us. So if you can hear us, there's a little chat box that you can see, and just want to go ahead and put a 1 in the chat box, just so we know that you can hear us. Here's Allie. Great. Okay, so it looks like most people are in, and we're not having any technical issues. So I just wanted to start today, and we will have this open for questions. You can let us know, you can chat your question in that same chat box. You can let us know that you can turn, you can turn your microphone on, and we can also help with that. So please ask as many questions. This is what this is for, is to really keep us all connected. And we're also on, I think, Facebook right now. So if there's questions from that, hopefully those will come into us as well. And we're going to go and start with just really updates on what happened. We know that you down at the state legislature, you passed the emergency funding. I think there's a lot of questions around where that's going, what's happening with that.
Yeah, so at the state level, we have passed $100 million in COVID-19 related funding in the last 3 weeks. We 3 weeks ago passed $50 million that was specifically designated for the healthcare response and for public outreach and public health purposes, to be able to ramp up the healthcare response here in the state of Arizona. Because one thing that we do know is we only have about half of the hospital capacity that we're going to need if we hit full peak COVID-19. So that's also why we're practicing social distancing and encouraging people to stay home and to not have close contact and not do any extra trips right now, because we do want to be able to take some of that strain off of our healthcare system to flatten out the curve, to be able to make sure that people are not unnecessarily dying because we don't have enough hospital beds, we don't have enough respirators, we don't have enough ventilators for everybody who could possibly need one at the peak of what this infection rate is going to be.
And so you were talking about full peak, and we heard a little bit today that they're saying full peak might be closer to May. Is that what the information you had when you were still down there? Or?
The information that I have from Dr. Kara Christ, who is the head of the Arizona Department of Health, said that full peak infection rate is probably going to happen around mid-April, and full hospitalization rate will happen around early May. We are seeing about a week lag time between when people first start showing symptoms and when it becomes severe enough to be hospitalized.
Okay. And I know that there's a lot of concern about shortage of supplies. You talked about that to get our hospitals ready.
Yeah.
Do we see that moving quickly? I mean, there's still the concern. There was an article, I think, today that, they don't have enough resources, masks, obviously PPE. So I know that that's really stressing people out right now. Yeah. Is there something that you can tell us there?
So over the weekend, Arizona received our first shipment from the National Strategic Reserve, which brought about a quarter of the supply that was allotted for Arizona. We've already placed the order for the second quarter of the supply, which would get us to halfway. We are working with some local manufacturers to start ramping up production locally. We've got a great company, PDAP here in Tempe, who is going to be making face masks. We've got 3M, which has a manufacturing plant in Mesa, which is going to be turning out those N95 respirators and face masks. And we've got other tech companies that are starting to build parts for ventilators, things that are typically manufactured in China. Here in the East Valley, we've got those machines. We can crank out those parts, and our large manufacturers are really stepping up and stepping forward. And we've even seen our microchip manufacturers here in Chandler in the tech corridor stepping up and donating warehouses full of clean room gear that can be used in hospitals as surgical gowns and as draping.
Is there a mechanism that's, warehouses are stepping up, but there been a kind of an operational outreach to others that possibly have, maybe that haven't had stepped up yet, or that don't know where to go? I mean, do you know that that's happening with some of these different businesses that could have enough protective gear?
There are. We've made we've done a lot of outreach through the Arizona Tech Council, and we've done a lot of outreach through the Chambers of Commerce's to these large manufacturers to try to get them up and running. The president's executive order and authorization of the manufacturing funding has really lit a fire under people, and it's helping to keep our economy here in Arizona churning.
It's great. So this has been already just with that question, because we've been talking a lot kind of internally about what is that supply chain look like, and what about I'm really glad to hear basically that you've reached out to the Arizona Tech Council and you're all working together on that to ensure that people know the resources. And I figured as much as we watch, but this is really good insight. I could keep asking you questions, but is there anyone that has a question? Kind of just raise your hand. I can see you visually, and I'll try to, if you're visual, there we go. Yeah, go ahead.
So does that mean that those companies might be hiring, and that's something for people who, like especially service sector people who just lost their jobs, to be looking out for?
Most of these manufacturing companies are at full staff already, and they're trying to keep their staff utilized. So they're not really hiring a lot of people additionally. They're just trying to keep their own people employed. There are companies who are hiring quite a bit right now. That would be all of your grocery store companies. Amazon is hiring almost 3,000 people here in the Valley. But it's going to be hard on our economy, and it's going to be hard on our state. 80% of our state budget comes from income tax and sales tax, and guess what we're not getting right now is a lot of income tax and a lot of sales tax. So it's gonna hit our state really hard, and unfortunately that's just the reality of it.
Good point.
But one thing that I have been getting a lot of questions about is the testing kits. And Arizona State University and University of Arizona, their bioscience labs have really stepped forward, and they're about to have another 7,000 kits available by Friday. So we should be able to start really ramping up testing.
That's good. I haven't, there's a company, Kinsa, that has their that tracks data for fevers. And it looks like Mojave County is pretty high.
Okay.
But I haven't seen any testing in Mojave County, like Kingman, the Veteran Center up there, that sort of thing. So is there have you seen organized effort for getting test kits to where they might be needed the most?
It's something that we're working on. It's one of the things that the governor has activated the National Guard to do, is to help distribute all of those kits. I do know that today the Havasupai tribe had their first positive test case come back, and they're the tribe that is kind of down in the bottom of the Grand Canyon. So we could possibly see a big hotspot there if it's not properly contained.
Okay. Yeah, I see some people online who are trying to, they think that Arizona is safe because we don't have the population density of New York, but I think it's just that we haven't tested yet.
Yeah, we have been far behind on testing.
Jennifer, have you heard any I mean, there's been some talk in the last couple of days that maybe this has passed through already, mild. We're hearing that from other places that people might have been affected and didn't know. Is that something that was talked about? I mean, or what do you tell people that are thinking, well, maybe it's not going to.
No, what we're seeing from the CDC and from disease modeling is that the center part of the United States, kind of where we're at in the center southwest, we're about a week behind what California and New York are dealing with,
Right.
and we're about 3 weeks behind Italy as far as outbreak goes.
Yeah. Are there any other questions? Anybody, you can unmute and ask anything that's on your mind. I know it's a lot of information. We're very grateful for this.
Yeah, and I know Anita is going to send out some websites and resources that we've been collecting at the state legislature to everybody who's on tonight, just to give you some
And actually,
places where you can go, where you can order food to be delivered. There is information on internet service providers. If you've got families in your community that are trying to get access to low cost and free internet service for children who are doing homeschooling, both Cox and CenturyLink have put together full packages. Arizona PBS has partnered with the Arizona Department of Education to offer distance learning classes via PBS broadcasting.
Nice.
And then Governor Ducey today sent both the National Guard out to food banks to get them fully stocked up, but also put in for a expansion of the food stamp program. So we're hopefully going to have that expanded by the end of the week.
it looks like we have a chat. Okay, somebody's having some internet connection issues. Hopefully we're not having that across the board. Let me just mute. All right, yeah, we will send that doc that was up on the screen that Jennifer's talking about. Sorry. Everybody's in their homes with all their people in their homes and kids. So if you're hearing background noise, I apologize. We'll send that out to everybody to make sure that you have that resource document that she's put together, which is great. So any other questions before? I don't want to keep you if we don't, or is there any other comments you want to add about stuff that you've hearing, concerns that you've heard from others?
We are just really trying to do all we can to keep state services going and also respond as quickly as possible to direct needs on the ground. So today you saw, or sorry, on the 20th, the governor put through expansion of unemployment benefits. Today he announced that he is expanding the telemedicine. So anything that would be normally covered in a regular office visit is now going to be covered through telemedicine. So if you need to get in any of your therapies, if you've got a child with special needs that needs occupational and speech therapy, it can now be covered through telemedicine, which was not available before. You put through a stay on evictions for the next 120 days. If you're a renter and you're laid off or you're furloughed because of COVID-19, or you're taking care of a family member who is ill or in need, then you cannot be evicted from your apartment for 120 days. That's not saying you're not still responsible eventually for that rent, but it's saying that you cannot be forced out on the street for the next 120 days. And the governor is now also requiring private labs to give total number of tests given so that we can have a proper denominator for our 401 positive cases that have come back as of today.
And I think that number was finally talked about today, and I'm not remembering the exact number, so I don't want to say it was quite higher than we had heard before of how many were tested.
So there's been about 6,500 test kits done in the state of Arizona so far. Of that, 401 have come back positive, but there is still like a 3 to 5 day lag period between when a test is taken and when it's processed. And that's because they're still getting the machines up and running. So hopefully all of that will get the kinks worked out sometime this week.
Yeah, especially since Banner didn't start testing until Monday. So
Yeah.
at least not except for ICU cases.
Yeah, and really, ASU and U of A really stepping forward to create those test kits to put together more reagent is really going to have a great impact on the number of tests we can do here in the state of Arizona.
We have a question from another Anita. You can go ahead. Oh. You're unmuted. Can you hear? No? Okay. Well, we will. I'm not sure. She raised her hand for a question. Yeah. Some people joining as well. So let me just get them in here. Any other questions for Representative Jermaine?
No, thanks for all your hard work.
Thank you.
Thanks, Erin. All right. Well, if there's, I did want to, one other thing that I saw that Governor Ducey did today, he did ask for people that are on, that need insurance, that suddenly have lost health insurance, to open up that enrollment period. Knowing that, I mean, also knowing the federal government, I think that should have been part of something we've done initially already, but do you feel like that's likely to happen, kind of from what you've seen?
I hope it will happen. Losing your job is a qualifying life experience. So
right.
Typically that would allow you to qualify in the first place.
Right.
So hopefully they'll be able to get that opened up and get people enrolled into the federal marketplace. And it's great to see Arizona supporting the Affordable Care Act in the federal marketplace.
Yes. Nice change, right?
Now if we could just get Bronovich to drop Arizona out of the lawsuit to get rid of ACA.
Well, yeah, that would be wonderful. Okay, I think Anita has her question and says she might be able to do this now. Let's try again. No, doesn't look like it. Okay, well, let's see. She's asking it in the chat box, so we'll go ahead and just read that. Can anybody who wants to get tested even without symptoms, where's the status on that, and where could they go if that? I don't think we're there at that point. We still are limited.
So as of right now, Arizona is still restricting who can get tested. Most of the tests are being done at emergency rooms, and they ask that you do call ahead and let them know that you're coming before you come in. If you are showing symptoms, if you're not showing symptoms, they're not going to give you a test at this point. But we are hoping that once full production ramps up with the ASU and U of A labs building those kits and creating that reagent, that we will be able to test anybody who wants to get tested, but we're just not there at this point right now.
Any other questions? No.
We have
Oh, is that a question? Nelson?
No.
No?
No, not us.
Okay.
I'm in meeting.
All right. Okay. Well, thank you. I think we want to also talk a little bit, and you're welcome to stay on, Representative Jermaine, or if you need to go, we understand either way. We wanted to also talk a little bit about what's happening with the stimulus package coming out of the federal government. It's still not law. It's still not passed. They have reached an agreement, so that should happen hopefully quickly. It's taken a while. And I think that, you know, a lot of us have hoped and wanted for cash directly into the hands of the American people. It looks like that will happen. Hi.
Hello. We're listening to you.
Good. I'm glad. Is there a question for any of us before?
We thought we had a question, but
Yeah,
now we
yeah. I
forgot.
was just thinking that what should we do with the mail that comes?
Yeah.
Do you think we have to take precaution in handling the mail?
And I read that mailmen and mail delivery people are also concerned for them. So it's like a major question for.
I don't know.
Yeah.
Right.
Yeah.
Yeah, so what we do know is that the virus can live on paper for up to 24 hours. I've personally been letting my mail sit overnight and not touching it until the next day.
Okay.
But it's up to you. I know that my personal mail carrier in my neighborhood does wear gloves when he touches the mail. But what I've heard from the unions is that that is being left up to each individual postal carrier if they want to wear gloves or not.
Yeah. And we let ours sit for 3 days for now because it was all junk mail.
Yeah.
Yeah, if it's mostly junk, it's fine, right? Yeah, I mean, any precaution you can take at this point. We don't want to be fearful, but that, you know, we've seen that data that it can live on paper, it can live on things. You know, the best thing is wash your hands a lot, right? Even if it's been a day, wash your hands, kind of keep that regimen up so that if you are touching something mistakenly, because we forget too, we're so used to doing these things instinctively. That's something to keep in mind to continue to do.
Yeah, and to wash your hands frequently for 20 seconds at a time. We always sing happy birthday when we wash our hands because I have a little one. So it tells us how long we need to wash our hands.
Yeah, I have a few appointments with the eye doctor and also dentist and so on. Do you think I should postpone these things, or we can still go to the clinic to see these doctors?
I would call your doctor's offices and make sure that they're still seeing people. A lot of doctors' offices are only seeing emergency cases because they have donated a lot of their medical equipment to the hospitals for direct response to the crisis. So I would call your doctors personally and ask if your appointment is still good or if you need to reschedule.
Mm-hmm.
Yeah. And the groceries we buy from time to time, like eggs, for instance, or vegetable and so on. Should we be careful about the eggs, for instance, whether they have been handled, they are polluted, they are contaminated, or what? We don't know.
Your food should be fine. Again, I would just let it sit for a little while before actually handling it. Your vegetables, wash them before you eat them. Soap and water.
Yeah, that is definitely.
And the stores are so very careful now.
Yes.
Shopping today and Costco and Sprouts and everybody is keeping distance and serving you one at a time. They're just very careful.
Mm-hmm.
Yes, and we've seen a lot of amazing community members and a lot of community companies stepping forward and being good actors and being polite and courteous to each other. And that's one of the great things about Arizona.
Jennifer, have you heard of a new virus that has just been found in China again? Hantavirus or something? I don't know.
I have not been following that. I've been completely and solely focused on what's happening here in Arizona on the ground so that I make sure that I'm being able to respond to what's happening here right now.
Uh-huh.
Yeah, and I have not heard of that either. So something to look into.
We had the hantavirus here before, maybe 20 years ago. It was related to mice up in the Four Corners area. So hantaviruses are not new. And there's been some, I don't know what to think yet either, because I think it's mostly noise that's being passed around to distract from the coronavirus. So
Probably could be. Yeah.
Uh-huh.
Just fear. A lot of people are scared, and now it seems like, oh, could it be another thing? And yeah, go ahead. And then we have some other questions. Cyrus, go ahead. Do you have another thought?
I don't have any question. Do you?
Good.
No, should I live in a different house?
Should we divorce or
Oh, yeah.
something like that?
That's too soon.
That's funny. So Anita Romaneski is also asking, she was concerned about mail, cash, coins, bills. I have credit cards. I've heard this from others as well. Some people are wiping their credit cards down. You know, I personally, when I go to the grocery store now, I know that I'm touching my phone and I'm doing other things. So I just wipe it down when I get home. But I don't know if it's going to live on there. We've heard paper, but you know, if you're nervous, I think it's always a good idea. And her second part of her question, or can pets be carriers? And what I've heard is no, that there was that one unique test that seemed, but not overall. I don't know if you've heard anything else, Jennifer.
Yeah, what we've heard from the Humane Society and from veterinary professionals is that your average house pet is not a carrier for this disease.
Mm.
And to please not drop your animals off at shelters because they're overloaded. And if you can adopt right now, please adopt an animal.
Oh, yeah,
Yes.
I would. I love to play with my neighbor's dog. That's why I said good. We don't have
Yeah.
it.
Well, and it's a wonderful time. And, you know, I know our shelters are promoting that this is a great thing right now with everyone being so isolated. Animals bring such security and joy in these types of times, and they need us and we need them. So it is a time if you can do that, to bring an animal into your life.
Yeah, and Arizona Humane Society and Maricopa County Humane Society have waived adoption fees at this point. So if you're looking for a new pet, now is a really great time to adopt because they're trying to get a lot of pets into homes.
Yes.
Mhm. Yeah, and there's a shortage of volunteers.
What about volunteers?
There's a shortage of, so with people staying home and a lot of volunteers at pet shelters being older, being retirees, then they're trying to get the population down at the shelters because they won't have enough people to take care of them. So, and I know that like the Sunny Slope shelter also had pets up for foster. So even if you don't want to make like a lifetime commitment, they were looking for people to at least foster a pet while they're sheltered at home.
Look into it. Thank you.
And then also I read it was a scientific study, I could find the source, but this virus is particularly sticky on metals. So like I would wash cans or anything like soda cans, any kind of cans or metals, I would wash them more carefully. And this virus is actually less sticky on cardboard and paper. So it doesn't live like more than 24 hours, but like they just did testing on one of the cruise ships that had cases, and 17 days after the ship was evacuated, the virus was still found on metal surfaces. So,
But if we have cans at home, it won't have virus, would it?
After probably 48 hours or
No,
24
but we have
hours.
had it forever.
Yeah. Yeah, like cardboard and paper, it doesn't live as long.
This is before Corona, we had the can.
Our youngest daughter she's at U of A and she's studying microbiology. So I get to learn lots of extra things about viruses.
Yeah.
Yeah, anyway, this is so wonderful. I mean, that we have this facility of consulting with you, and this is excellent. Are you going to repeat it or what?
Repeat this session?
Yes.
Yeah, so we're doing chats. There's another one Monday. We're trying to do as many chats as we can. We won't have Representative Jermaine on unless she will join us again, which we can ask her right now. But we're trying to do these as much as possible, and some of them we don't have all this information. It's been great to have her on, but we will try to keep people connected and finding out what the questions and concerns really are. So for sure, yeah, they're on the website if you want to sign up for another one, and we'll keep adding. We're just seeing what people are really demanding right now, and some people are feel overwhelmed and don't want to participate, and we understand that. And some people are just need the connection, and that's why we're doing this. The connection's important. So
It's very important.
I
But
found all the information that you shared, Jennifer, really helpful because it's not all the detail that I could find in the statements from Doug Ducey or what's actually happening. So I find that really comforting. Thank you.
Yeah, and I've been on my Facebook page really trying to push out as much information as I can with what's happening here locally in Arizona and especially in the Phoenix Valley.
Mhm. Yeah, the Scottsdale compared to the other parts of Phoenix and around is less affected or what?
We don't have the breakdowns that far down in we only have county level breakdowns. So in Maricopa County, we've got about 100 and almost over 200 cases.
wow.
So Maricopa County is really the hot spot in Arizona right now. And then there's also another fairly large hotspot up in the Navajo Nation.
Oh,
Yeah, I have one very particular question. Our son and his wife and his daughter, they live in New York. He's a professor of Columbia University. About a month ago, they visited a person who were positive. Later on, they found out that he was positive. In 3 days, the three of them, my son, our
His wife and daughter.
wife and daughter, they got fever, and my son had cough for about a week or so, but now they're all right. Do you think they have to go and test and check or what?
I'm not a doctor, so I would say you need to ask that question of a doctor, but if they've already recovered, there's not much that can be done for them other than seeing if it's still living in there, if they've got blood titers to tell you whether or not they've had it. But at this point, there's probably no point in having them tested, but I'm not a doctor, so I can't tell you what their symptoms are.
Thank you anyway.
The testing advice coming out of the federal government and the CDC has been, if you don't have active symptoms, then, you know, save the tests for people that do. But if they're still feeling a little ill, it might be worth it just calling in and triage. A lot of places you can call and just say, this is what's, don't go in, don't go anywhere, because then if they still are actively contagious, right? But call and I would have them run through their symptoms with a medical professional and they'll let them know if they should or not.
Mhm.
Right.
Good.
Yeah, and a lot of times, even if they can't do anything directly for the virus, they can treat some of the symptoms with over-the-counter medication.
Thank you.
We have some people that are hopping off, but if there's anyone that hasn't got to ask a question before we have to go, we do have some more time. Anyone else that has a question that hasn't got to ask anything?
Sure. Well, if you're here, then I'll ask one more question, which is just, so as far as like what we've seen in other areas, is that they need more beds because of the recovery time being so long. So even just having people in different stages, being in different like facilities or beds, like observation versus ICU versus actually on a respirator, all of those kind of different things, and not having them all together, making it worse. I haven't seen any action yet on setting up any kind of field hospitals, or like this hospital is going to stay reserved for non-COVID cases or anything like that. So, or commandeering hotels or anything.
So far, Arizona has not needed that, which is probably why you have not seen the mobilization around it, though. But that is one thing that is under Arizona's National Guard order, that if they do need to build field hospitals very quickly, they already have the authorization to do that from the federal government. It was in Governor Ducey's original request to activate the National Guard.
Okay. I didn't know if it involved the Army Corps of Engineers or if we could.
No, that can all be done by our National Guard. Our National Guard are amazing men and women, and they're engineers in their real life, they're doctors in their real life, and we're lucky to have each and every one of them.
Awesome.
Okay, thank you very much.
Thank you.
Thank
Thank you.
you. Does anyone have questions about anything at the federal level that we can talk about? Otherwise, we will probably just wrap up because I know that everyone is overwhelmed with information. I actually had one more question for Representative Jermaine. Is we saw that Secretary Hobbs wanted to go to an all-mail ballot for the elections. Was that something that was kind of give us what happened really with that? I know they didn't obviously did they not talk about it at all before you recessed, or what really happened?
It was not discussed at all before we recessed. I know that Representative DeGrazia had been working with the Arizona Association of Counties on an amendment. It was not allowed to be presented when we did the skinny budget. It is something that we're hoping to talk about when we come back into session on April 13th. But right now, a lot of that is up in the air. And the governor does have very broad powers under his emergency order. So we're hoping that the governor can go ahead and request an all mail-in primary for the August primary, because we do know that this is a marathon, in his words. This is a marathon.
Right.
And it's going to take time until this passes through Arizona.
Right. Better to be safe. Yeah, it is something they tried to get into the stimulus package. I haven't been able to figure out if it's still in the final one that is going to probably be voted on anytime now. So that was something from the federal level, was to get the money and grants to be able to do this across the states, to have more resources to go all mail and to have early voting periods, because not every state has even mail like we do. So
yeah,
interesting.
Okay.
Erin, it sounds like you were going to comment.
Oh, I was trying to figure out if the Wyden, Klobuchar Wyden, if that had made it into the bill for tonight's vote, because I know they were pushing hard for that.
Yeah, I couldn't find that either before getting on here. So we'll find out and we can send it out.
Fingers crossed.
Yes.
Okay, we're gonna
All
say
right.
good night. We have to go have our dinner.
Yes, please eat, stay healthy, take care of yourselves. Everybody, I mean, the one thing is protect your own immunity too, right? Eat, just because we're sitting at home, don't eat all junk food if you can avoid it. Get good rest, take your vitamins, do everything you would normally do when you're trying to stay healthy from the flu and all these other things. Your immunity is so important in this time.
Yeah, I bought a lot of junk food today. I said, if I'm gonna die of corona, I never
You
eat.
can have some, you just don't want to eat only junk food, right?
Fruits and vegetables, please. Fruits and vegetables, please.
And I will say, I don't know, we know the grocery stores are different in every part of the county, but I had noticed in my local grocery store a clear shift in the last, I've gone out probably like every 4 to 5 days I have to go out for stuff. And it went from the things that were the staples, not, being available, the rice, the pasta, the cans. And then now it seems like those are there, but a lot of the fresh stuff is going faster. So it's an interest. I think cyclically we'll also see that as people start to realize that we don't need to hoard all that stuff. It'll be more available. But we also have, and I'm sure that those of you know that a lot of the grocery stores have changed their hours and there's times for seniors to go. And if there's any information like that, we're collecting all as much as we possibly can. We're actually going to have it all available in a community group soon. But if you need anything from us, you can reach out to our campaign, reach out to Jennifer, or Representative Jermaine, her website. She has a lot of information on Facebook. We'll also send you that doc we showed as a follow-up to this. So stay healthy, everybody. Thank you for joining us.
Thank you too.
Good night.
Thank
Thank you.
everyone. Bye, Cyrus.